Welcome to our webinar titled The Effects of COVID-19 Virus in the African American Community in Greensboro, a Community and Faith-Based Response. My name is Christina Young, and I will be the host and moderator of our panel discussion today. I am a health equity activist and a co-coordinator of the Social Justice and Advocacy Ministry at St. James Presbyterian Church, along with my co-coordinator Lolita Watkins at the historic St. James Presbyterian Church. And we say that because of the prominent social justice activists that have been members of our church, such as Dr. George Simpkins, John Irwin, Fred Cundiff, Dr. Nan Manuel, Dr. Neloise Watkins, and so many women and men that surround us as a cloud of witnesses for the work that we do in social justice ministry. I'm going to share with you now our session objectives. You should be able to see the segments that we will be showing today. Segment 1 is the public health implications of COVID-19 in Guilford County. Segment 2 will focus on best medical practices for prevention. Segment 3, local government response to COVID-19 in vulnerable communities. Segment 4, working together across organizations. And then segment 5, the faith-based response. And now I would like to welcome some of our panelists. Today, we are blessed with a wonderful panel of speakers, and they will be joining us one by one. First, starting with Dr. Annette Bay. Good morning, Dr. Annette Bay.
Good morning. How are you?
I am doing well. Thank you for joining us. Dr. Annette Bay is the medical director for the Guilford County Department of Public Health. Next, we will be joined by Dr. Vanessa Haygood. She is an OBGYN member of Cone Health's medical staff and a member of the Greensboro Medical Society and the Old North State Medical Society. Also, she is a member with us of Social Justice Ministry at St. James Presbyterian Church. Welcome, Dr. Haygood.
Thank you, Christina.
Last but not least, we will be joined by Councilwoman Sharon Hightower. Hello, Councilwoman Sharon Hightower.
Hello, good morning. How are you?
Doing well. Sharon Hightower represents District 1 in the city of Greensboro. And so we will begin with segment 1, which will focus on the public health implications of COVID-19 in Guilford County. All right, Dr. Bay, welcome to our segment 1, where we are focusing on the public health implications of COVID-19 in Guilford County. Thank you for joining us again. And my first question, we're starting off with that we're interested in learning about any emerging health disparities within our city. What are the current racial demographics for African Americans as it relates to the coronavirus? And then why are we seeing these differences by race?
Good morning, and thank you for allowing me to participate with this panel discussion. So to understand how the COVID-19 virus is affecting African Americans and what are some public health implications. And when we look at disparities in North Carolina, in Guilford County, Greensboro, we have to look at the disparities that we see across the country. And in Louisiana, Chicago, Michigan, we see that the percent of African Americans that are dying from COVID-19 sometimes it's 2 to 3 times the percent that African Americans represent in a population. For example, in Guilford County, when we look at mortality rates, African Americans suffer mortality rate of approximately 36% for diabetes. And if we look at Caucasians, the rate of mortality is 17%. So that is a disparity that we would expect to see translate as we look at the death rates for COVID-19. So in Greensboro, we are not seeing that particular proportion or disproportionality for African Americans. And African Americans, if we just look at living below the poverty level, we'll see that African Americans, 26% in this county, live below the poverty level. However, Caucasians, we'll see a rate of 10%. So looking at our population, and we look at the population of African Americans, 15% of the total population in the United States is made up of African Americans. However, 34% across the country are dying from the COVID virus. In North Carolina, African Americans make up 22% of the total population, and overall, 30% of all positive cases are related to being African American, and 34% of the deaths are related to being African American. So in Guilford County, though, and in Greensboro, we did not see this type of racial disparity in COVID-19. And it may be due to the fact that we have not done the amount of testing that we should have been, but we're catching up. And lab reports, some labs are not giving us that data that we need for race. So in Guilford County, about 31% of the COVID-19 cases are related to being African American resident, while the population percentage for African Americans is 35%. In Greensboro, the population percentage is 42%, and the cases for African American are 27%. About 30% of the COVID deaths are African American in Greensboro, and the population for African American in Greensboro is 33%. Additionally, we need to realize that 85% of the deaths in Greensboro are related to having an age of 65 and over, and 40% of the positives for COVID-19 are in the age ranges from 25 to 49. So deaths are higher in patients that have chronic medical conditions, hypertension, diabetes, lung disease, kidney disease, and for those patients that are immunocompromised.
Wow, thank you. Thank you for breaking that down for us. It's very important for us to pay attention to the data. And so thank you, because that lets us know the context where African Americans are falling in this pandemic. And so my next question is in regards to making sure we understand clearly, how is it spread? Would you please describe how the coronavirus is spread exactly? For instance, how can someone spread it if they are not showing any symptoms? And what are your recommendations for close friends and family who really want to mingle and gather and get together?
Okay, so the virus that causes COVID-19, from what we're understanding, and remember when it first came out, it was called the novel coronavirus, and that's because it's new. So everything that we're learning about it sometimes changes, and we're learning new things every day. But at this point, it's thought to spread mainly from person to person through respiratory droplets that are produced when you sneeze, when you cough, or when you talk. And so these droplets can land in the mouth or nose of people who are nearby, and possibly can be inhaled through the lungs. So spread is more likely when people are in close contact with one another. And it's also possible, like you mentioned, to get COVID from touching surfaces or objects that have the virus on it, and then we touch our mouth or our face. So we do know that individuals with coronavirus can lack symptoms. And when you lack symptoms, we usually say you're asymptomatic. And then those who will eventually develop the symptoms, they're referred to as being pre-symptomatic. And that means they can transmit the virus before they ever show symptoms of the virus. So that means that the virus can spread between people who are interacting and in close proximity, for example, when speaking, coughing, or sneezing. And so even if people are not exhibiting the symptoms, if you're doing the things that I mentioned, you still have a ability to spread the disease. So in light of this new evidence that we have, the CDC, that's the Center for Disease Control, recommends wearing face covering when you're in public, and when you can't distance yourself for that 6 feet, or when you're shopping or in doing community activities, it is recommended that you wear that face cover and maintain a 6-foot distance. So when you wear the face cover, that slows the spread of the virus and can help people who may have the virus and do not know it from transmitting it to others.
Thank you so much. That helps with a lot of clarity because there's been some questions around that face cover. So thank you so much. My next question is about where can people in Guilford County get tested?
That's an excellent question. So Guilford County Public Health Department is trying to be on the forefront of that robust testing that we need to see happen in the community, because testing, again, identifies who in the community is testing. So Guilford County has been testing since the middle of May, and we continue to test into the month of June, and we have testing sites that are set up already. And initially we were at the Oakland parking deck, and we have been at the Windsor Recreation Center. There is a number that you can call for an appointment, and you will have a screening performed. I can give you that number right now, 336-641-7527, and that will be a confidential pre-screening during that call, and that will determine whether you are a candidate to be tested. Since we have noticed this disproportionality in terms of race, the guidelines for what or who is a candidate to be tested has really broadened. So pretty much people in minority communities, people who are vulnerable or living in situations, homeless, they can get tested. And if you are someone who is over 65 and have chronic medical illness that may not be treated well, may not be controlled well, you also can get tested, but they will go through a series of questions for you when you call that number. And this testing is free, but we do ask that you bring, if you have insurance or you have Medicaid or Medicare, to bring your insurance cards.
Okay.
We also will be having testing in High Point, and that will be near the end of the month of June. And when you call for an appointment, they will give you an appointment if you need testing in the High Point area.
Okay, very important for us to know where to go. So thank you.
And one thing I do want to also mention is sometimes people have questions that they want to have answered. If you want additional information about COVID-19, we have a public health COVID-19 hotline for that purpose, and that number is 336-641-3245.
Okay, excellent. Thank you so much. And my final question is about what should somebody do if they find out they have a positive, that they are carrying the COVID-19 virus? Are there consequences if they do not abide by the quarantine?
So when you show up to have testing performed, when Guilford County Public Health does that testing for you, you're given information as to what should happen if your test is positive. And what I want to explain today is there are two terms that we have to be clear about, and that's quarantine, and that is used to keep someone who might have been exposed to COVID-19 away from others. And quarantine helps prevent the spread of disease that can occur before a person knows that they are sick. So once you're tested, and that's why it's so important that we start testing so that we can identify people who may be candidates to be kept away from other people. If you are found to be positive, then you would be asked to isolate. And so you're given instructions so that you know which category you fall into. So if you're isolating, that is used to separate people now who are infected with the virus from those who are sick and they need to be isolated and they need to stay home. Implications of violating quarantines. A quarantine order, as we call it, is a legal binding order, and there are repercussions for people who violate it, and usually it's very severe. But in this pandemic emergency, we don't want people to be incarcerated because, again, we're putting them in those kinds of environments where they're going to be exposed to become infected. So we would want for our community to understand and take that personal responsibility for following those instructions. And isolation may be a little difficult for people because you have to be separated. You may not be in a situation where you can be separated. And in that situation, we would want you to have an area in the home that that person would stay in, and if they have to use the same facilities, just to wipe them down, clean them very well, and have utensils that only that person would use. So as much as possible, that person should not intermingle at that point with the other people in the households, because sometimes it's not easy to isolate when you have other members in the family. So the isolation and quarantining, that becomes important when you know what your status is. And that's why with a face cloth, when you go out, you don't know what the status of those people in the grocery stores are. So that's why it's encouraged that you wear the face covering. It's encouraged that you stay 6 feet apart. So in that, we have a person, somewhat the personal responsibility is on us, but a quarantine order, yes, it is usually, under normal circumstances, enforceable if you are found to be willfully in violation of it. However, we would like to educate and change behaviors with knowledge rather than force in this situation in the pandemic.
Wow, thank you so much. That is new information as far as what's happening in Guilford County in regards to all of the things that you shared. So I really appreciate that.
Thank you for the opportunity. I know I kind of rushed through it, but I hope we were able to highlight some of the important things with data and with the evidence that we understand at this point, and our own personal sort of responsibilities.
Yes.
To keep everyone safe.
Thank you so much. Yes, indeed. And we will have some more questions at the very end. So I hope you can stay around with us for that
Absolutely.
time. And right now we are going to transition to our segment 2 with Dr. Vanessa Haygood. Welcome back, and thank you for being here this entire time with us, Dr. Haygood.
Well, this is an exciting opportunity.
Thank you. Yes, it is. We're going to learn as much as we can. Yes. And so on that note, my first question to you is about the symptoms of the virus.
Well, first of all, I want to re-emphasize that there are many people who have contracted the virus who have absolutely no symptoms at all. I cannot reinforce what Dr. Bay said enough. That's the reason that we all have to be diligent about protecting ourselves and protecting our neighbors, because we could actually be the asymptomatic person if we've not been tested. So there are people who have absolutely no symptoms at all. Most people who actually contract the virus are going to have mild symptoms. And those symptoms might be a cough, it might be some mild shortness of breath, it may be some shaking chills and a fever. There may be some muscle pain, there may be headaches, sore throat, and a newer set of symptoms that we have learned is the recent loss of the sense of smell or taste. is also a set of symptoms that can go along with coronavirus. Then you get into the people who are severely ill. Those are people who are going to have a repetitive cough that causes them to be short of breath, sometimes even at rest, who are going to have more of the high fevers, the shaking chills with severe muscle aches, headaches that are intractable, and sore throat that cannot be managed. Those people need to seek medical attention immediately, particularly if you notice any blueness of the lips, the inability to even get out of bed because of shortness of breath or severe muscle aches. What I would say is if you are one of those people who develops mild symptoms, it's a good idea to call your doctor's office and say, these are symptoms that I am having, because that allows you to set up a line of communication that should those symptoms become more severe, you can call and they will already have a record. The second thing I would emphasize is Dr. Bay gave 2 telephone numbers. One is for pre-screening for testing. The health professionals who answer that can help you understand whether the symptoms that you have are significant enough that you need to seek medical attention right away. And the COVID hotline that is personneled by Guilford County is another source of information should you have questions about symptoms that you're having. So mild symptoms is what happens with most people if those symptoms progress, especially if those symptoms progress in someone who has underlying medical conditions that put you at higher risk. And Dr. Bay has gone over those.
Very important. Thank you so much for sharing that. And so I'm so curious about all of these things. I'm interested to know, have there been any updates about any treatments or vaccines for COVID-19? And is there any additional guidance other than what we hear about wear, wait, and wash that we need to know? And then regarding the face cover, is that sufficient? Because there's still some questions about that. For instance, can we reuse, how often can we reuse the face cover?
Well, let me start first with the question around vaccines. There are a number of vaccines that are being actively investigated, and we are very hopeful that a vaccine is going to emerge. But typically vaccines take quite some time to develop, and I don't see that happening in the next few months, during which many people can become sick, and unfortunately many people can die. So it's important for us not to wait for the vaccine. There is really no specific treatment for COVID-19 if you are outside the hospital setting. There is medication that is being studied. It is being used primarily in hospitalized patients who are very ill, and that's called compassionate use, which means the medication has not been proven to be effective, but there is some indication. And in a study protocol, those medications can be given and the results recorded so that we have a better idea as we go forward in this rapidly changing landscape about which medications are going to be helpful and which are not. So there are some medications that are being given to people who are severely ill. But what I want to say is that one of the most important things to do in managing this COVID disease is to maintain your baseline health. If indeed you have diabetes, work very hard to keep it in control. If you have hypertension, work very hard to take your medication, change your diet, do your exercise, all of the things that your healthcare provider has been telling you about managing that chronic condition needs to be stepped up a notch. Because if your baseline health is better and you should contract the COVID virus, you are likely to do better than if those conditions are out of control. So that's the second thing I would say. Third thing is the wear, wait, and wash is something that we can easily remember, But if we begin to break it down a bit, there are some things that should be focused on. The first thing I'll say is wash. Hand washing is a powerful tool in curbing the spread of any infectious disease, and this one is no different. 20 seconds, everybody's tired of singing happy birthday, but you can count the 20 seconds. There are other songs that you can sing, but 20 seconds with soap and water, washing your hands every time you think about it. Definitely when you come from outside to inside, definitely before you eat or do anything that puts your hands close to your face, are all times when you should be focusing on hand washing, teaching children to do the very same, and modeling for those children that persistent hand washing. And then the weight. That's the 6 foot distance that we are having such difficulty with. There are people who seem to be offended in the grocery store line when the vendors have taken the time to put a line between you and the person in front of you. It is social justice. It is love for your neighbor. It is what we as Christians are required to do, is to take care of our neighbors. So stay 6 feet away from people that you might be in contact with out in the public. And then wearing a mask. You've asked some pretty detailed questions about a mask. One difference I will make is typically masks are the medical grade materials that are used by our health professionals. Face coverings can be one of those masks, but it doesn't need to be. Now you ask about reusing them. Most of the masks that are used that are medical grade are designed to be disposable. The N95 masks that are available that are the most effective and that we are trying to reserve for our healthcare professionals can be sanitized and decontaminated, but that is a process that has to go on in a facility that is used to doing that. But out in the public, we can use any cloth face covering that covers the mouth and the nose and puts a seal across the chin. So the cloth face coverings that have ear loops is great, or ties in the back, as long as it kind of seals off this area. Those can be washed and should be washed. Those are really primarily to protect your neighbor, to keep your secretions from moving away from you and towards your neighbor, but they can sometimes also protect you to some extent. And that is helpful. It doesn't completely eradicate your ability to pick up the virus, but if you use each one of these measures, then they're additive. And so they add up to what we can do to protect ourselves. I hope I've answered your question.
You have. Thank you so much. And my other question, because we're getting really into the information now, is what systemically can be done to protect our communities and our most vulnerable communities where we live?
So systemically, the first thing I've already talked about is the management of chronic conditions. And we know that in our African American community, first of all, we are more likely to have chronic medical conditions. We are more likely to suffer complications from those because we are less likely to have access to adequate medical care and to have all of the information that we need to do the self-care that would help with that. So the first systemic thing that needs to happen is improvement in access to medical care. The second thing that I would say, and this reiterates Dr. Bay's comments, testing. And testing is not just a one-time thing. It is, you may test negative today, But when you go to your job where you are a cashier in a grocery store, and you go through the weekend where you have come face to face with thousands of people, some of whom were courteous enough to wear a mask, some of whom were not, then you still could be at risk for the virus. So repetitive, regular testing, particularly for those people who are in those public-facing occupations that puts them at risk every time they go to work, is something that needs to be done systemically. We're doing so much more testing in Guilford County than we were before. The health department has really put together a robust schedule of testing. It's published in the newspaper. It's oftentimes advertised on radio stations. So I would have everybody try to understand that those tests are available. And quite frankly, anyone who is African American is probably going to meet the criteria for testing. And so I cannot say enough to take advantage of those opportunities. There are going to be other organizations that are very interested in stepping up the opportunities for testing, because testing is going to be one of our most useful tools in stemming the spread of the virus in our neighborhoods, particularly in our African American neighborhoods where we have so many of our vulnerable citizens.
Thank you. Thank you so much. Our last question is just about the concerns about the second wave coming of the pandemic. Is there anything you want to remarks you want to make about our being concerned or cautious about a second wave of this?
Yeah, I think that we have done such a great job in our area trying to flatten the curve on the number of infections and deaths that we have experienced, that people have become a lot more relaxed about the precautions that we were taking. But we really shouldn't necessarily let our guard down. There's going to be a very difficult walk the line between living a full life and remaining vigilant against a virus that really has not gone away. But we should not lose our talents for washing our hands. We should give ourselves the kind of distance that that we need to avoid either giving someone a virus or receiving it for someone. And, you know, I don't know how long the face masks are going to, if you will, be tolerated by the public. But again, it's an act of charity, it's an act of love for your neighbor to make certain that when you are in close proximity and cannot social distance, that you do something in terms of a face covering to protect other people that are in that same environment. The one other thing that I want to say is that vaccines are going to require testing, and those testings are going to require volunteers. We in the African American community have a very legitimate suspicion of research that is done on people. And so oftentimes we are less likely to volunteer for that. But I would encourage us as a community to become involved in medical research, because that really is the only way that we are going to know how those new innovations affect us. But at the same time, I understand that people want to be vigilant about what they are volunteering for, and we should never be afraid to ask questions about what is to be done with the results, how will this affect me, what are the risks that I'm taking, and then to say no thank you once you've done all that if you find that the risks are greater than the benefits. But I do want us to at least consider being part of the investigations that are going on for vaccines and new treatments.
Very important. Thank you so much. Thank you so much for encouraging us to ask questions, encouraging us to think about what is access to adequate medical care, and that us to consider the risk and to consider the benefits outweighing the risk. And so I really appreciate how you explained that, as that is critical for our communities because of our history, for sure. So thank you so much. And we'll have some more questions for you at the end as well. And now we're going to switch to our third segment with Councilwoman Sharon Hightower. So thank you for staying on with us. And so we're going to focus on the local government's response to COVID-19 in vulnerable communities. And my first question for you is, has our local government received any funding from the state or the federal government to combat the COVID-19 virus? And if so, has it or will it be used? And how can individuals access these funds?
All right, thank you so much. My apologies for that. But I appreciate you having me as part of this panel, and thank you for the questions. And let me say, there's a twofold answer. So when you first asked me, my first inclination is to say no. Well, that is an accurate answer. But I will also say, yes, we have gotten some dollars from the federal government as it relates to HUD and housing money. But no, the local government has not gotten any money allocated to it for any of the virus acts that we have been doing here in the city. The county got $93 million. And out of that $93 million, we have yet to receive any dollars. We did make application to them for the monies we spent thus far of a little over $2 million. With our employees, we have funding in there where we spent money for cleaning, salaries, where we did some small business lending support. And so we have asked for reimbursement on those dollars, but nothing came directly to any municipality, even through the state. Now, there's currently some legislation going on that Senator Robinson is putting forth to get us some dollars, but nothing that was directly coming into our coffers per se. But we have still done things that are the right thing to do on behalf of COVID's support for our personnel as well as our city. But there's no money for individuals to access. No.
Okay. Thank you for clarifying that, because there's so much in the news coming out about that all the time. So my next question is about, how is the city of Greensboro assisting the homeless community in relation to discovering the presence of the virus?
Well, one of the first things we did, we stepped up to make sure that our homeless were protected. You know, they tend to live in camps. They live together, so the possibility of a spread was great among them. So we opened up our sportsplex and we moved them into the sportsplex. And as we began to look at how we could transition them out, we began to work and get them into hotel space. Some that needed testing did get some testing during that time as well. But we have received dollars from the federal government that addresses the CARES Act. And in those dollars, we received a little over $2 million plus dollars, but about 600,000 of that is dedicated to what we call rapid rehousing, so that we help our homeless begin to transition into some type of permanent, stable housing if they're open to doing that. But we have been addressing that with homeless, and we have always worked with our homeless population. But it really did become a concern that there would be a lot of spread among them. And so we think we have to mitigate that quite a lot.
Okay, thank you for sharing, because I wasn't aware about the sportsplex, so very helpful. The next question is about accommodating a place for people who have become unemployed And if they're facing evictions due to this pandemic, how is the city helping in that situation?
Well, the twofold piece to receiving that $2 million of the CARES Act money from HUD, there's a little over 1.3 million that we're going to dedicate specifically for rental assistance, and even some of it will be mortgage assistance. And in those dollars, whether you'll need help moving with your first month deposit and rent, to be able to help you if you're evicted from one space to another. Now, even before the pandemic, we do that anyway. But we've done a concentrated effort with these dollars, the CDBG money, Community Development Block Grant money, that will focus on that and working with those partners that already do this work. So we don't have to set up anything new. We just continue to do the way we've done in the past and how we deal with rental assistance when individuals are evicted. So we are working and collaborating with those partners, focusing on those individuals that now, because of the pandemic, and really because of other economic situations, okay, not just the pandemic, that's added to it, yes, but many of those were already in bad circumstances before COVID came along, and I'm still trying to figure out how to live economically and safely. So we're looking at that and how we can help those, with rental assistance, like I say. So we're working real focusedly on that.
Okay, thank you. Yeah, because that goes into the history of the African American community and
Absolutely.
economic wealth issues. And so thank you. My last question for you is about how is the city keeping public places safe, such as the buses, such as parks, business strips of where businesses are located in the African American community, such as where beauty supply stores are located, or salons and barbershops. How is the city helping to keep the public places safe and clear of the virus?
Well, there are some things we can do as public government, but then there are some things we can't. So your private businesses, that's very difficult. They maintain and control their own, okay? But for city spaces, we are focused on the cleaning, making sure they're sanitized. So we've invested in the medical cleaner that will, sanitize areas. We clean our buses. We're cleaning, of course, obviously, right now, rec centers aren't open, but we are talking through how do we open our rec centers and keep them safe for our young people who don't know much about social distancing. They're just ready to come in a space and have a good time. We certainly want them to do that. We want them to remain safe and healthy. So we're focused on making sure we're cleaning that. We clean our offices regularly, if you will. The city, if you know, reduced our public hours from, and we were only open 10 to 3 to the public, and we only opened one building. It kind of controls some of, people just kind of meandering in and out, if you will. So we've done a lot of work around that, tried to be as proactive as we can be about that. And it's going to be hard because when you talk about a basketball court, how do you keep that sanitized? That's going to be difficult. And we know that with our swimming pools and all. But looking at private spaces, back when the governor's order with the stay-at-home order, and we were trying to make sure that we were helping to enforce, the stay-at-home, not being in spaces, not gathering more than 10. And so we got many calls from individual citizens that said, we see certain places that are open, and why are they open? Those beauty supply stores, they have very small spaces. And so we would go in and try to talk with them, educate them about you need to social distance. These individuals need to have masks on. The spaces are tight. The aisles are little, if you will. And which was the extent of we're trying to do that and emphasizing the governor's order. The city had a stay-at-home order, which was a little bit more stronger than the governor's order. And sadly, when the county chose not to extend that, we lost control, basically, on how we were really managing to maintain those spaces. Started sending mixed messages and people became confused. They just kind of feel like it's okay to be out there, when it's really not. It truly is not.
Thank you so much. And was there anything about the buses that the city is doing?
Well, one of the things we did do, we reduced the times that we are doing pickup. Normally we pick up every 30 minutes. And we decided to move that to an hour pickup. And between that, you know, and the hour pickup, that allowed us time to clean a bus, get it sanitized. We protect our drivers, if you will. They're wearing masks. And so we even reduced the amount of people that could ride the bus to be able to have social distancing, because, you know, on a bus, people just kind of pack themselves in. And so we kind of had to do that, and we didn't want to inconvenience people who really were essential workers, trying to get to work, trying to get, you know, to places they needed to be at, grocery store, doctor's appointments. And so we had to start limiting that. We had to start asking people, where are you going? You know, not to invade their privacy, but to make sure this was a trip that was necessary, because it was about keeping them safe as well. So, and we continue to even offer now fare-free rides. So we're not charging individuals currently to ride the bus. So for those who needed to get from place to place, economically was an issue too. You know, we got to look at it as a holistic problem. You know, we got to focus on that. So we even made the fares free.
Okay. Well, thank you so much. It's really important for us to learn what's the city's response to what's going on with the COVID pandemic. And I want to open up our conversation now to all of our panelists. I do have some questions for all of us. What can we do?
Christina, if I can, before you start your question, I want to touch on testing.
Okay.
Okay. Mm-hmm. And I've heard some comments around testing, and testing is important. But for me, as a representative of a primary African-American district who's disproportionately affected by COVID, testing in our community was seen as an afterthought. We had to go and advocate to get testing in this community. There was testing on the north side, but there was not testing happening over on the east side. And that is just now beginning to happen, and we felt like we were left out. Okay. We have testing coming up now, but in having those conversations with Novant Health, Cone Health, the public health, there were no spaces for testing going on over here on the east side and in the African American community. And it's just now starting to happen. And that's a little disturbing for me as a representative of people who are being impacted disproportionately by the COVID virus. You know, and I think we have to really start to look at, you know, those things better. We have to do a better job of that. And, you know, in all of our lives, we have to fight. And it seems like on every end, we're fighting to be relevant about something. And even in the testing in the community, to me, it felt like I've got to fight for that. So I had to pick up the phone and say, hey, where's the testing going? Why should we have to catch a bus to go to the north side of town to be tested? We need to be doing it here. We've got churches, we've got spaces that are open. And yes, now they finally did Windsor Center. But even that was a push to get done. That we have many places over here. And it's just now starting to happen in this community.
And that's why I want to see how we can do better, because I agree with you 100%. We need, if it's a vulnerable community, virus that's disproportionately affecting African Americans, we need the testing. And so how can we work better together? And maybe there's some suggestions, because I know we have different organizations represented here, on what are some ideas going forward, because we had to fight. And I appreciate your speaking up for our District 1 citizens. And so what are some suggestions for us better working together to help African American vulnerable communities?
Well, for me, it's communication.
May I just respond to that?
Mm-hmm. Okay, we'll come back to you, Councilwoman Hightower. Dr. Bay, did you have an answer for that?
I don't know if I have an answer, but I do have a response. In the beginning, when when we were in a pandemic, the ability to test and test kits were not available to have that happen the way that it was being advocated for over the television. And so the reality for us in certain cities and communities that we didn't have the capacity to test because we didn't have the kits. And so we need to understand how we got to where we are. And the COVID virus is sort of like an onion that's sort of, you peel it back and you can keep seeing, because of systemic racism, why African Americans, we're doing badly and have poor outcomes in every aspect of our health and well-being. So it's not surprising. So not only for the coronavirus, we are still working on these same kinds of issues in our communities. Coronavirus just peeled off the peeled the skin off the onion, so to speak. And so, and with testing, with the in public health, the magnitude of what we're trying to do, like you say, does involve partnerships, and the health department has worked with other resources in the communities to partner with to do more testing, because the health department has a particular capacity to do certain things, and testing to the magnitude that we need to see happening in communities does require a partner, because there are still things that the health department is doing with TB, with STIs, with maternity care. Those things, mandated services are still going on. So when we can partner with organizations, and we have worked with the FQHC to assist and help them to ramp up testing, that's where we'll get into the communities where we need to be. This was something that is very different from normal public health testings and screenings. Having personal protective equipment for your staff that's going in it, that was also important, and making sure you have capacity for that. So a lot of things go into what we're trying to do. And right now, with this panel discussion and opening up for partnerships, that's going to go a long way in getting some of the things that we want to see happen with the testing.
Mm-hmm. Thank you. And Dr. Haygood, did you have some ideas around coming together across the city to help our vulnerable communities?
Yes. First of all, I'd just like to echo everything that Dr. Bay said. You know, if we watch television, you feel like testing is readily available everywhere. But quite frankly, here in Greensboro, community testing, that is testing outside of hospitals and outside of doctors' offices, is really a fairly new thing. And we as a county have funded our public health department, but we've also asked a tremendous amount of them in many different areas. That having been said, the other important thing is having the right people at the table. And clearly, Councilwoman Hightower has been a long time advocate of the people who ended up in this pandemic being burdened above and beyond their chronic burden for getting health care. And so part of the partnership is going to be identifying someone who can be at the table and say, well, yeah, I know you've got only a certain amount of dollars, but if you look at the proportion of people who are affected, we need to try and spend more of those dollars over here. So I so appreciate our opportunity to come together as several different entities to begin to form some of those partnerships so that the right people can be at the table representing those people who are most vulnerable. So I so appreciate what you have had to say, Councilwoman, because I know I've been in this community long enough to know that, number one, you're not going to bite your tongue, and number two, that you are a long-term advocate for the people who need this most. And so going forward, we're going to have those partnerships between the medical community and the Greensboro Medical Society and the Guilford County Health Department and Cone Health and Novant Health and High Point city leaders and Guilford County leaders that we hope are going to put all of our citizens in better stead for the very beginning of getting at this, which is going to be testing.
Well, thank you very much. And I look forward to all those partnerships. And you're right. We're here on the ground and we're always ready to help this community. You know, I mean, I know sometimes people say they don't know who to contact. You know, I heard some of that, but you know, we are here. There are leaders in this community you can reach out to, whether it's in our churches or at our political level, that, you know, are out here representing these individuals that, you know, need to have assistance. And so, yeah, we've got to pull those partnerships together and make sure that that vulnerable community, you know, is taken care of and represented in various ways. So I look forward to moving it forward. And yes, ma'am, you know, I thank all of you for what you do too, as well.
Looks like there's a pause.
Thank you very much for saying that, because that partnership is critical to the growth of this community and the way that our citizens get treated, our residents, our African Americans citizens get treated. You know, many of them say they just feel left out. And I too was beginning to feel like, well, we're just left out. You know, they're having the conversations, but they're having them all around us. And we're not at that table. When you're not on the table, you're on the menu. Mm-hmm. And that has to stop.
And that's why I hope that this conversation is leading us towards, we talk about this table, and this is important that people listening are inviting us to more tables so that we can continue to be decision makers for our own communities, because as you are listening in to the panelists here, they have a lot of strategic ideas. And so we want to continue to be the decision makers for what's happening in our communities and not have decisions made for us. And so thank you all for those answers. And our last question is just about, because we are sponsoring this from our church, St. James Presbyterian Church, what do you have suggestions around the church's response and other faith-based houses of worship? What can we do to support the people in our own congregations as well as around us in the community? What should the faith-based response be? What do you think about that?
Well, I think, Christina, we've already started with that with this particular informational session. This needs to be publicized. It will be on our website and accessible for people to look at over and over again. There will be telephone numbers and contact numbers that people can get additional information. People can make appointments for testing. People can understand where testing is currently scheduled. So that's the first thing, is to be a source of trusted information. And then the second thing is for us to understand that social justice is part of what we're called to do, and to forge stronger commitments and stronger bonds with our local and more remote governments to the advantage of the people that we are privileged to serve.
I would just like to echo that, and also that we need to continue to educate with facts and understand that the landscape for everything that we do is going to change. It's not going to be going back to normal. It's developing some new norms. And if that means when we have our services. Maybe there's more distant services. Maybe there is more ways that we can speak with the scientific evidence that's causing us to make decisions and not feel that there is a conflict or a competition with what we're trying to accomplish, because what we're trying to accomplish is safe communities. We want to decrease the spread. And if that's something that we all support and we can all stand behind, and it comes from a place of trust, which for the African American communities, it's the faith-based organization is that place of trust. And I think it is a duty to have the correct information that we're asking people to adhere to and understand the issues and concerns around vaccines and concerns around treatments. So we have to be personally responsible ourselves, and to also discuss things like mental health and mental illness during this very difficult time. And sometimes faith-based organizations don't want to get in that space, but that's something very critical, particularly with this pandemic, and we don't want to avoid that. And I think the elephant in the room that we haven't really talked about at length is systemic racism and bias, and that North Carolina did not expand Medicaid. So that is something that goes unsaid, and we really need to own that, because when you're in a state where people can't get that testing, it should have happened a lot earlier. But it's not only North Carolina, it's the areas of government that that's responsible and didn't act the way that it should have acted months ago. Coronavirus was not identified first in the United States. So there are lessons that we can learn from other countries that have successfully come through with being exposed to the virus and have not had as many deaths from the virus that we have sustained as a country.
Thank you so much for saying that.
Well, and I would just agree with them, Christina, in their comments about that, where our faith churches, they play a significant role, and they are a trusted source. But I think that now with the new normal, they have found a virtual platform that they can use to get the message out to those that even they may not have had opportunity to be in a church on Sunday, but who now see church talking and providing information. We've got to educate and inform our community about what is available to them, and give them and provide them access to, being able to get tested or, get other treatments in various areas, what resources that the city can provide, that state government, federal government, that our health community can provide. And so I think that we have to capitalize on the fact that the churches are really the starting point of knowledge.
Thank you so much. Thank you so much. And so as we are coming to a close of this, we want to continue the conversation with our community, of course, but if you all have any closing remarks, I'm going to allow you a moment to give any last thoughts you have. So I'll start with Dr. Bay, then Dr. Haygood, and then finally with Councilwoman Hightower.
Oh, thank you for that. I totally enjoyed participating in the panel. And if I can only express, there are many things I would like to express, but I'm only going to take my little public health piece of it and just encourage us all to adhere to what has been proven to decrease the spread of the virus. Know that there are ways that you can be tested, particularly for African Americans. The expansion of the criteria has, even if you don't have symptoms, you can still get tested. And the other thing I want to remind people is that all positive tests are reported to the health department. We have been given resources, haven't seen them yet, but from the government that should help us, from the state actually, that should help us to do what's called contact tracing. And that's going to enable us to be able to not only identify you who is positive, but also any of your cohorts that also may be positive and don't know that they're positive, so that they can be identified and know that they should not be exposing others. So if I can get that message out there, that there are testings, and even the testings are being, drive-ups and drive-throughs are being offered by CVS. So the ability to get a test, candidacy for that has really broadened, almost exploded. So the tests are out there, get out there. And even in High Point, we're getting to High Point, it's out there now. Let's take advantage of it, and let's work together to get it done.
Thank you. And Dr. Haygood?
Well, what I would like is that everyone who views this seminar that we've done today, share it with somebody, put it on their social media page, encourage all of your friends to know who your representatives are in all of the public spaces. If you are in District 1, you see your representative. You see Dr. Bay, who is the medical director of your county health department, and take ownership of these resources, take ownership of the resources that are going to be shown as part of this presentation, and really spread this word.
Thank you. And Councilwoman Hightower?
I'd just like to say that, to my African American community, please take this serious. I know sometimes we don't feel like that it is impacting and affecting us. Now, when we see the homicides that are happening, we know that's a physical effect. When we see the events of the day that we are protesting for, police brutality and our civil rights, we know that. But this virus is also impacting us, and it's through our health. And one of the worst things for me has been to call it social distancing. It should be physical distancing, because people think social before they think distance. And I just want them to understand, the impact of this, of the 3 W's, the wear, the weight, the wash, and how critically important that is for them. And then for them to know what resources are available out there for them. And to know that they have city representatives, they have state representatives, and yes, they have federal representatives, even though sometimes you're not happy with what you see. But you have to have a voice that speaks out about that. And there are people who do have voices that are speaking in positive ways to impact our community, make change that we need to see have happen. And so I want our audience to know that, and know that they're supported in that regard, and that we will continue to fight for them, and for them to be treated fairly, and to do justice for them. And I want them to recognize that.
Thank you all so much. This is excellent advice that you have given. And with this being hosted by our church, we know that Jesus was a social justice activist and he overcame the world. And so we are encouraged to keep doing what we are doing in social justice to find equity for our vulnerable communities, our people. And so thank you, Councilwoman Hightower. Thank you, Dr. Vanessa Haygood. Thank you, Dr. Annette Bay, for what you have done. I also want to thank Lolita Watkins as a co-coordinator of social justice with me, and Robert Powell as well. And all of our social justice activists out there where you are, keep doing what you're doing. Pay attention to the resources that will be provided for you through this seminar, and we look forward to staying engaged with you. Thank you all so much.
Thank you.
Thank you.
Thank you for having me. Thank you so much to everyone.